When severe floods hit Kasese and other parts of Rwenzori sub-region in May, thousands of people were forced out of their homes. They are now just returning home to washed-away houses and latrines. As we moved around the affected communities, we saw this man, January Mwaka, carrying a hoe. He told us he had just been easing himself in a bush.
We
use hoes to dig a hole and defecate. When it's night time, we use buckets and bury the feces in the morning.
Like Mr. Mwaka, many households returning from temporary shelters are yet to construct pit latrines, which has left the Deputy District Health Officer worried about worsening the existing hygiene problem.
100 households, only 79 households have usable latrines. It means the 21 are still practicing bush defecation in Kasese, which we need to fight and find a way that we improve our coverage to 100%. This implies that when we get outbreaks, they are not doubted. Our district is still prone to getting what? Epidemics.
For the past 5 months, Save the Children has been running a sanitation and hygiene campaign, WASH, to, among other things, construct semi-permanent latrines for households and schools in communities affected by the May flooding.
I'm very happy because we will improve on personal hygiene, and we will not be fearing people when they pass near.
Actually, we have 426 pupils, and we cannot operate a school without a toilet. That one is a basic need. But at the moment, I think we are a bit relieved.
Richard Muke, the Save the Children coordinator in Kasese, says they have assisted only more than 100 families, but the gap of those still in need of support remains huge.
If I can just take a quick example, provide them with water treatment kits. You're talking about, we reached about 1,010 households. But I mean, the emergency had more than that. So yes, you are able to reach that number. Let's say, okay, we are able to say we have constructed 10 stas latrines at health facilities and primary schools. They will be able to reach to more than maybe 10,000 people. Mama kids, you are able to reach 100 lactating mothers. But again, you know that there is still gaps in terms of the entire recovery process. Talk about their livelihood. Because for us, we are really focusing around WASH. But there are other, certainly the gap was around recovery in terms of livelihood.
Malnutrition may occur in some children, as I can tell you, because these children are feeding poorly.
Tadeo Muhindo, the District Disaster Management Coordinator, condemned the practice of open defecation, saying Kasese's latrine problem must be handled at family level.
This is quite calling for a hand to improve on that situation. In any case, somebody should struggle hard to have a temporary structure to take rid of that mess. We shall continue the sanitation, but I condemn it.
The Save the Children boss in Kasese called on other agencies to intervene to ensure a safe re-establishment of livelihoods for the more than 400 affected households. Edward Mhumza, NTV.